This video is going to explain how to do a concept map. For your first one, you're doing it as a group. I'll give the 8 of you in your clinical group a disease process to do a concept map on. You should all work on it together, and then this will be attached to your clinical paperwork. So in other words, you're all submitting the same concept map for this first one. And then you're also going to have an article attached which contains an evidence-based intervention for this disease process. I'll cover that in the other video. Right now, let's talk about the concept map. I know it looks like a lot, but let's break it down. I'm going to give you a disease process, and that goes right in the middle here. You see diabetes. And this whole middle section, you're doing the pathophysiology. Just think that pathophysiology, you should be telling a story of how this disease develops. It should be kind of like this leads to this, leads to this, and you're just telling a story. So look right here. Insulin resistance causes blood glucose to remain high, which causes poor circulation. That poor circulation damages blood vessels, and that causes that, and so on. So that's your middle section here. It needs to be as long as it needs to be, okay? What I mean by that is if you just have 5 little things, that's probably not enough. But I also don't need like 30, okay? Just try to outline the main parts of the disease. Up here, you'll need predisposing factors, and on the right, precipitating factors. I know this sounds like the same thing, but just think of it this way. Predisposing factors increase your risk for the disease, whereas a precipitating factor is some event which caused the disease to flare up, so to speak. So you can see here, high blood pressure and a sedentary lifestyle would put you at higher risk for diabetes. Whereas if you broke your left femur, that's a traumatic event which could trigger diabetes immediately. Okay, medications, pretty straightforward. What meds are used to treat this disease? Labs, what labs do you expect to be out of range for someone with this disease? Vitals, same thing. What would you expect to be abnormal? Signs and symptoms, pretty straightforward. Over this side, I talked about precipitating factors. You will need 1 nursing diagnosis for a patient who has this disease. You will need 3 goals. Remember, these are SMART goals for a patient who has this disease. You'll need 5, it's a lot, 5 interventions, nursing interventions you could do for a patient who has this disease. You'll need to evaluate if your 3 goals have been met, okay? So each goal needs to be evaluated. So you see how there's 3 goals, there's 3 evaluations. And then you'll also need to include 2 things a patient with this disease would be at risk for. Now, all these arrows look really confusing, but the whole point is you just need to recognize the relationship between everything on this concept map. So every single thing you put down needs to have an arrow to what it's related to. So, for example, these meds, they drew an arrow to what part of the disease they manage. For your signs and symptoms, they drew an arrow for what it's related to. So on and so forth. You're just making connections here. Now, the first one's going to be rough, but I'm sure all of you working together, you can do a pretty good job, and you'll have this example to go off of. Now, the tricky part is one of your interventions, just one of them, needs to be evidence-based. And so what that means is the school wants you to do some research and find an article that was written within the last 5 years that backs up one of your interventions. So you see here, number 1, it says educate patient on diet due to health condition. You would have to find an article to support that. And I'm going to go over that process in the next video. So that's in general how you complete this, and it will be attached to your nursing care plan. So here's your care plan for the week. It's what you've been doing usually, and then you'll just include it after your S-bar page. I hope this video helps, and we will go over it tomorrow in post-conference as well.